Good morning, everyone. So we're going to chat today about behavior assessments. We're going to talk a little bit about what's involved with them, why we do them, what we need for an assessment. We're going to talk a little bit about some of the science. There is so much science on this. This is not going to be a total science talk. If you were looking for that, I'm sorry. It's going to be a bit more science and practical, because I'm guessing that the reason why you walked in here today is you want to have a better idea about what to do at your shelter. So hopefully I'm going to provide you a little bit with that. So when we think about the components of a behavior assessment, some sort of behavior assessment, a standardized assessment that you provide to the animals in your care, what would be the components that are included in maybe your assessment or those that you've seen before? Sociability. Cool. How would you measure sociability? Or how would you go about it in this assessment or in your assessment? There's literally no wrong answer here. Please don't be.
Our back on it, but
sure.
Just to see, do they seek our attention?
Sure.
Do they persist in seeking attention?
Yeah.
Or are they just looking for the story?
Yeah, absolutely. What else?
Dog-to-dog interactions.
Yeah. Whoops, sorry, 1 second. How do you do those?
We do a lot of on-leash interactions.
Yeah.
Parallel walking.
Nice.
To just see their play style and kind of whether they want to interact.
Sure. Awesome. What else?
Oh
boy, we're going to do this again. This was a thing I learned yesterday that I'm not very good at this. Okay, so the first question was about sociability. The second response was about dog-to-dog interactions. What's next? That's all we're doing? Do you come up to me and do you like dogs? This is fast. Why are you all complaining about this?
Resource garden.
Sure. Right, that's a really touchy subject, and we're actually going to talk about it today. Right, and that can comprise a lot of things. It can be just about food in a bowl. It could be about if a dog gets something like a bone, how are they around that? What else? Yeah?
Behavior before the animal shelter?
Oh, question. Behavior, yep. Right, so what we're talking about is a little bit before the behavior assessment, actually, right? And that'll be kind of a little bit about what we talk about after the assessments is gathering information about their life before the shelter, right? I think that's a huge piece of it. What else? Yeah?
We walk them through the shelter to see how they can interact being in the kennel, being out of the kennel, how they're walking past the other animals.
Sure. So we were talking about how the dog is walking around, probably things that they're going to be doing during their stay. So we have a lot of sort of things we're talking about here. This is from a publication by Taylor and Mills, where this table describes the 20 most commonly reported subtests. We'll just call them situations in a temperament test for pet dogs. And so you guys mentioned some of them. There are things like object play. How do you do when entering a room you don't know? What happens when you're ignored? What's your behavior on leash? How are you with weird noises? And then there are things that are a bit more provocative, right? How are you when threatened, there's an approach that's threatening, or a weird doll comes walking at you. What happens when you're stared at? So you can see that there's this sort of range of components of behavior assessments that probably range from something like fairly benign to something that's probably more provocative. So why do we use these assessments then? What's the whole point of it all? Better placement, okay? Understanding the animal. Am I doing it? Okay. Okay. Yeah.
Trying not to put a potentially dangerous dog out.
Trying not to put a potentially dangerous dog out into the world. What else? Have we got about everything? Yeah. Oh, sorry. Yeah. Thanks for raising your hand. Like, what politeness? Thank you. I don't need politeness, but I just recognize it. So thank you. Yeah. No, that's great. So what she was mentioning was about knowing the individual dog and really getting to know them. And so absolutely, right? Did anybody have anything else? Sorry, did I miss anybody? Okay. So yeah, we could assess safety. That was brought up. We could also be assessing adoptability. And when we say adoptability, which like, what the heck does that mean? Is there an adopter, or what kind of adopter does this dog need? Is the adoptability of this dog dependent upon the other dogs that are up for adoption at that time? Or what you think the community's ability is to care for that dog? Or what the severity or the type of, what the severity is or the type of behavior we're talking about. And so certainly, we might be using assessments to identify behavior problems that maybe the dog is going to need a plan in the shelter, or it could need a plan in its next situation. But so I ask you, because when I brought up why do we use them, we're asking this one thing to do a lot of things for us. And so, are we then asking, is this assessment supposed to predict future behavior in the home? Is it supposed to predict future behavior in the shelter? We want it to do both. That is a pretty tall order. And so when we take a look actually at some of the published goals of some of our well-known behavior assessments, here's what they what they think they're trying to do. For matchup 2, it's an objective way to evaluate dog behavioral tendencies and personality because the dog's responses in each subtest are described by observed behaviors, body postures, and movement without interpretation or judgment of motivations. SAFER is described as, it's designed to assess the probability of future aggression in dogs. And ASPCA, Sue writes, that it's supposed to understand the behavior and future success for each dog in a home, identifies congenial family pets, identify aggressive dogs before they prove themselves aggressive in someone's home. Oof. Okay. So, if we want to say then, it seems like a lot of this is about predicting future behavior in the home, right? We can all agree that a lot of those descriptions were about that. So, in order then to determine whether a behavior assessment is a good measure, the right measure, and a useful measure to be able to predict future behavior, here's what we need. We need the assessment to be standardized. So the assessment protocol minimizes the variability between tests. And that's like test to test, not subtests. It has to be reliable, valid, feasible. And then with these standardized tests that are reliable, valid, and feasible, we can obtain objective, quantifiable information which we can then compare what's observed in the shelter with what's observed in real life to determine then the assessment's quality. But to do all of that, we need validation. And so what do we actually need for an assessment to be validated? Well, so there's that idea of reliability. And what we might call that is a goodness of measure. Are subtests free from measurement error? So we can first think of intra-observer reliability, which is consistency with the same assessor. We can then think of inter-observer reliability. So that's consistency between our assessors. And then we also have test-retest reliability. So this consistency with the same dog at different time points in its stay in the shelter. Are you guys starting to see how hard this is? Yes. And so related to reliability, then, we have consistency. And that means that repeated subtests between tests, observers, environments are going to produce correlated results. Not the same, but they're correlated. We have precision, which freedom from random error. Here's a kind of graphic about what high precision and low precision means. It doesn't mean that it's the right answer, but they're all getting at the same thing. And we have sensitivity, which is something that's been discussed quite a bit in the literature, which is this small change in the true value. And we'll say the true value is the behavior or the personality characteristic we're interested in, is actually seen in our subtest. So how you behave in real life is going to be captured in this subtest. And if that changes at all, or your behavior, say for example, around strangers changes in your life, that's going to be picked up in that subtest, versus if you were tested previously and you were fabulous with strangers, you would be testing differently. And then that resolution, which is the smallest change in that true value, can actually be detected. So that's related to reliability. And then we have validity, which is, again, the rightness of the measure. So We have to think about appropriateness, meaningfulness, usefulness of the specific inferences we're making with these behavior assessments. So there's various types of validity. One type is what we call content validity. That means the test measures what it should, and the subtests measure all aspects of the behavior in question. We then have construct validity, which is this idea that the extent of the subtests within the assessment measure this broad construct, which we'll just call temperament, but you could use any label you want, that they were designed to measure. Whatever you think you're measuring, you should hope that what you did has measured it. And then we have this criterion validity, which is something we're pretty interested in, which is also known as predictive validity, the association between scores on these subtests and then that external criterion, which is real life. Okay. So not only is that enough to kind of like, oh, crap. But then we have this idea of feasibility, which is something we run into at the shelter all the time, which is, you know, our ultimate aim, or in this case, like what we're utilizing, is an assessment that can be performed in the shelter, and we can actually make use of the results. So it's fine if we could satisfy all that stuff in the beginning, but what if it took like 2 hours to do in the shelter for every single dog? That's not necessarily going to be helpful to us. So we have to have something that is straightforward, that's easy to administer, and that, again, we're always caring about how is this relevant to real life outside of the shelter. So here's a table. This is a publication from Haverbeek back, I think, in 2014. And I've included here some of the assessments that they constructed a table in their publication that took a look at various studies that had behavioral evaluations in them. And they looked at things like how many subtests did they have. So we can see SAFER, Assess a Pet, Match Up 2. Those are the first three. And you can see kind of how many subtests there were, what's the duration of it, the types of traits they were evaluating, the number of dogs that were tested in the publication, and then some of the scoring. But you can see that on that validity criteria, that either it's not mentioned as it was in the SAFER publication. We have some in the Bolin and Horowitz paper, which I think is great. And then at least at the time that this was published, some of the validity results for the Matchup 2 hadn't been published yet. So it should surprise no one in this room that to date, no shelter behavior assessment satisfies the measurements of reliability, validity, feasibility, that are required in psychological testing to predict future behavior of shelter dogs. Okay. So I ask you, what are we trying to measure? Not our individual subtests, but at the end of the day, not why we're doing it, but what are we measuring? What do we think we're measuring about the dog? Let's just like take a step back. Like, why the heck are we doing this? Why, not the why, but the what. Okay, some of it's perception. Do you want to go into that a little further?
So when we're working with a prospective adopter and they're trying to get a good idea if this animal fits for their home, likely they're going to ask questions.
Yeah.
We may have already tried to do that assessment, and that gives them some level of comfort through the adoption process. And we've done this already.
Right. So essentially, I'll summarize, is that, because I'm supposed to, is that we're trying to do our due diligence and let the public know that it's not like we're just like, hey, have this dog. I don't know. You don't know. Right. We're trying to say that we've done what we can to try to understand the dog, and we care about what that dog is going to be like in that home. Yeah. Okay. Thanks. Not the best Reader's Digest. Who else? In the back? Yeah. And so we're kind of coming back to, like, is it about what we're worried about what the dog's doing, or is it about personality? So is it the personality of the dog that we're trying to learn about? Not what the dog's going to do, but who is this dog? And we could call it personality, right? Which are individual differences in characteristic patterns of thinking, feeling, and behaving. Or maybe we're trying to evaluate character, which is described as personality evaluated. Maybe that's what we're doing. Or it could be it could be temperament, which would be described as differences in behavior that are relatively consistently displayed when tested under similar situations. I think that's pretty close to what we're getting at. Or temperament has also been described as the genetic influence on behavior, whereas personality is that predisposition influenced by experience. But here's the thing that we're kind of up against in the shelter. Aren't we really just in the shelter? We have these grand plans, these grand schemes of what we hope we're measuring and why we're measuring it. But really, aren't we just quantifying a behavioral response to a specific stimulus in the environment by the dog? That's all we're doing. And that really this is just a snapshot in time of that dog. Can we all agree that maybe that's more of what we're doing, even though we have grand plans about what we want to accomplish, what we think we're doing? It's just a snapshot. So if we can agree then that it's just a snapshot in time, why should shelters have a systematic approach to behavior? Say you're not, maybe you use an assessment, maybe you don't. When I say systematic approach, I just mean that every animal gets the same thing or roughly the same thing. So why should we be systematic in our approach to understanding the behavior of dogs in our care?
One really cynical response is insurance liability.
I know. And to that point, right? Well, so pretty much we said liability. Sorry, repeat, liability. I hear that comes up in our work more often than you would imagine. I think that it's important to have a systematic approach because we don't have a foolproof screening of dangerous dogs during intake. We've all been in situations where a dog comes in through the door, and for whatever reason, maybe we don't know what happened before it came in the door, we don't know what the shelter was like for that animal, but it doesn't display the dangerous type of behavior that it does later on. And we just miss it. And that happens, and that's no fault of anybody. Behavior is dynamic. But the fact that we think that we can just see dangerous dogs without spending any time recording and collecting multiple snapshots, it's a faulty assumption. All of us have missed dogs. I've done it. I'm sure you have as well. And I think though that one of the reasons why this happens is because when dogs come into our care, many times they've never been in the shelter before, right? So they're scared, they're fearful, they're shut down. I think this sort of assumption that the sort of stress of the shelter plays out the same for all dogs is just wrong, and so for some dogs it might be really arousing to them, some it may shut them down, and so I think that we have to appreciate that it has differential effects on the dogs. But one thing that I will say is that sometimes these assessments have been compared to clinical diagnostic testing. But the thing is that if a dog is aggressive when we're observing it, when we are performing some sort of assessment, it's not like it's evidence of some latent or unseen condition. The dog is aggressing. So it is real and it's there. And I think that that's something to consider, that when we see the dogs behaving in certain ways, we can't unsee them. It is part of their repertoire. But that doesn't mean that now a dog is going to do it in all situations. I think we have to think really critically about it. What was the context? What was the situation? What was involved to try to understand, to put together the snapshots? And I think the more that we know about the dogs, the better. That doesn't mean that we have to keep dogs at the shelter for prolonged periods of time to get to know them, to know who the true dog is. But it does mean that we have to take all of these observations that we have and put them together to create a better puzzle. I think that if we can say we're not very good at predicting future behavior, we don't necessarily know about adopter satisfaction or retention. And I talk about retention because the opposite of return dogs is not retention. And that's why we've got to be so much better about follow-up, because just because a dog doesn't come back doesn't mean it's still in that home. And and that owner could have experienced problems that, that really could inform our practices. But because we're not following up and talking to the owners, we don't know what happened. And so we're all sitting here with our opinions in the shelter about who's dangerous and who's not. But then how much are we actually talking with owners to see about all those dogs we were worried about? Did they actually do the things we were worried about? I think that's like a really big thing we need to come to terms with, that we maybe haven't been doing that as well as we should. But just because a behavior assessment, we don't have one that's validated that can do any of that, that doesn't mean that we stop observing, recording, or interpreting behavior. This is what we've got to be focusing on, that we've got to be looking at what the dogs are doing, recording it as much as possible. And maybe this means you are the folks in this room that are going to be the interpreting, that you're going to be looking at those observations and understanding better what they mean, or you're going to be training folks in your organization to be doing it. But we've all got to be kind of paying attention to what the dogs are doing. And I believe in a systematic approach to understanding behavior because I think it's an issue of access to care for the animals. It's not fair that they don't have an opportunity to understand what their behavioral needs are. I think that every dog in our care should have the opportunity to spend time with us, to be able to understand what they need so that we can treat them if they need it, and then be able to have an appropriate placement option. What are your all thoughts on that? In the back.
That's a couple minutes ago, I was thinking I wanted to turn around and say the key phrase was in our care. This is the end of being in our care.
Mm-hmm.
And so what I'm always going to look at is what does this dog need in order to have the best care possible.
Right. That's fantastic. So I'm going to repeat that and hopefully I get it all right. But, taking a look at this as an opportunity to learn what the dog needs while they're in our care. Did I get it? Okay. And I would encourage you to think about assessments like that. Just turn it around a little bit in your head. Instead of saying it being something that I need to know what you're bad at, I need to poke and prod you to find some sort of true dog, which I can tell you isn't there. And instead say, what do you need during the time that I'm responsible for taking care of you? I think that we would feel a lot different about assessments if we saw them as a way to help the animals instead of making really hard decisions about who lives and who dies. So then with that, I want to chat a little bit about the studies that have been conducted about shelter behavior assessments and what can we learn from them? What are their nuggets in these papers that can help inform kind of our understanding, our practice? And so I'll start off with, a fairly controversial one. Let's just get into it. But this is an older paper from Kelly Bolin and Joseph Horowitz. This was published back in 2008. And this was from data that was collected a few years before that. I wanted to start off with some of the descriptives, which there were over 2,000 dogs that were assessed with what was an ASPCA evaluation. And all these 2,000 and some dogs were assessed by Kelly Bolin. And these assessments happened somewhere between 2 and 4 days post-intake. Well, one of the biggest things you see in this paper right away is that many dogs failed the assessment, 40%. And that failure was defined as either during the subtest of the ASPCA assessment, the dog either lunged with growling or snarling or attempted to bite in one of the subtests, or they stiffened and growled in 3 of them. So 95% of those dogs were euthanized. They failed the behavior assessment. And so one of the big sort of limitations of this work is that we can't study the future aggressiveness of these dogs. They're gone, right? And we don't know what they would have done in the home. And so I put that out there as something that, we do need to think about how we create studies in a way that we can learn more about dogs that we think fail and how our predictions match up with how they behave. So I put this out there. This is a complete limitation of the work. But one of the findings they had in the study was that 90% of the dogs that had a history of aggression before they ever came to the shelter showed aggression when they were assessed. Now, the big caveat here is that Kelly knew that they had a history of aggression, but I also don't think she's the type of person that would be looking for the dogs to aggress. But with that being said, I think that's certainly a limitation. But it's interesting to see that sort of lineup between how they were behaving in the home and what they saw when they assessed them in this evaluation 2 to 4 days post-intake. So while we don't have this opportunity to understand this relationship between the assessment and placement of dogs that were euthanized, we can glean some insights from these dogs that they considered borderline. And the dogs that were borderline were dogs that stiffened or growled on 1 to 2 subtests. They were in fact more likely to be returned for behavior problems than dogs that did not show any such behavior during the evaluation. I think that that's super interesting, right? And it just seems to suggest, right, that if these dogs have challenges during these assessments, there's something there. It's not for nothing. That doesn't mean we don't place them. It was casual, no one saw that, right? So that doesn't mean we don't place these dogs. That's not what I'm saying at all. But we have to recognize what this experience might be for the adopter and how can we go about supporting them. So when they took a look at the returns before they had this assessment in place and the 2 years during, what they found is that they had a 25% reduction in returns, right? It went from 19 to 14%. And they also saw a similar decrease in returns for aggression. But that 5 to 3%, is that really detectable in real life? It was statistically significant, but I think that that might be hard for us to kind of experience in real life or feel like it's making a difference. One last bit about this is that they also conducted owner follow-up. So not just the dogs coming back into the shelter, but they actually reached out to owners. I think a limitation of much of this work is that we're not going back into the homes and doing the same exact thing, and we're relying on owner report, and that can be challenging. But what they found were that dogs that were described as unsocial, so they failed that sociability test, and we were talking about sociability before, were 3 times more likely to have aggression issues. And dogs with a history of aggression were 4 times more likely to have problem behaviors in the home than those that did not. Again, this is not to say that we should not place dogs that are not as sociable as others or dogs that have a history of aggression. Please don't take that away from this. Hold on one second, I will get you. I just want us to know what sort of risk these dogs might have, or let's turn it around, what supportive care they need to be successful. Yeah, in the back.
I just have a clarifying question.
Yeah.
So behavior problems have been used a couple times in this slide.
Yeah.
Can you go into any more detail how, or was that just a general label?
Yeah, they had a general label of it. They called it, AP, aggression problems, or NP, no problems. So the one that I describe about having aggression issues, those are what they characterize as aggression problems. And then aggression, if you were taking a look at the paper, a history of aggression, they called a positive aggression history or something like that. Yeah, no problem. So we do have some categorization or lumping here that we're not differentiating between certain types. I think that's what you're getting to, and I think it's super relevant. In the back.
Was the decrease because they started euthanizing more of the aggressive dogs, or do you not, or?
Yeah. Hard to say, right? I mean, you would think that this probably played a role, but we don't know to what degree, right? I think that, looking at things like returns, I think it's a challenging metric because I think that there's a lot that goes on. What we typically find in the work that we've done on, say, for example, owner retention post-adoption, is that it seems to be sort of like differing patterns. Like if it's an issue with the pet not fitting into the home, they're going to come back much more quickly or sooner, 2 to 4 weeks, something like that, versus dogs that maybe it's an issue with the owner situation that might happen later in the animal's life that has nothing to do with the behavior of the dog. Okay. So another paper I wanted to mention was some of the work that Sarah Bennett did, taking a look at the safer behavior assessment conducted with dogs at intake, so day 0, and then 3 days after being acclimated to the shelter. And so just to kind of describe the setup a little bit, the same evaluator and assessor were used on day 0 and day 3, and the same helper dog was used for half of the dogs. And that was sort of to control for the fact that, hey, you know the dog, but the dog's likely going to behave the same way. So you kind of cut your losses by using it on half the dogs. So what they found is that in those individual subtest scores on the SAFER, 31 dogs showed a lowering of aggression when they had initial assessments on handling, higher assessments on handling, arousal, and food guarding. So it seemed that over those few days, they settled in, and there was essentially better scores for things like handling, arousal, and food guarding. But for 26 dogs, they actually had a higher score after 3 days on dog-related subtests, the dogs meeting each other. And so I bring this up because, we all have sort of different processes about if we're going to even do an evaluation with the dogs when we do it. For some of us that are in limited admission facilities, we might assess them at intake to try to understand what are we actually getting ourselves into. Other shelters that are open admission may wait a few days before they assess the dog. But I think an interesting question here is, what can we attribute these differences to? Is it simply, hey, this SAFER test, it's unreliable? Or do we think that actually the behavior of the dogs is dynamic? And in fact, maybe how they're feeling on day 1 or day 0 when they enter in the shelter and are maybe a bit overwhelmed by everything is going to change, is going to change once they settle in on day 3. And maybe being around all of those dogs, hour after hour, listening to all of them. For probably most dogs, I don't know if we kind of consider this is probably the most amount of dogs they've ever been around in their entire life. So again, this is just sort of food for thought for y'all. The next one I want to chat about is some of the work that Anastasia and Sheila worked on while at their time during the Center for Shelter Dogs, taking a look at how dogs performed on dog-to-dog assessments when there was a fake dog being used and a real dog that was being used. And so I include the sort of diagram that they had in the paper, which you can see that they had like this really clever, they did mirror images of how they walked the real dog and the fake dog, so they were essentially receiving the same thing. I would have loved to have seen how you walked one of these fake dogs, but I've always found it to be challenging to make it seem like it's actually a real dog. And so they used the same plush and live dogs throughout. They had, for their live dog, they had a 5-year-old pit bull type dog who had a friendly dog history. And then for this fake dog, they had this pointer looking type dog. I think you've probably seen him if you've ever seen the stuffed dogs. He has a look about him. So this was with 45 dogs that they conducted this study with. And so individually, the observed agreement with the behaviors was anywhere from 64 to 100%. And I wanted you to take a look first at this table that I have on 1. I'm sorry that table 3 popped up, but let's take a look at table 1 first. All right, so table 1, we have what were considered aggressive behaviors. And so aggressive behaviors, because what happened was they ended up taking the many behaviors that they coded during this procedure and broke them and essentially categorized them into 3 different types: aggressive, fearful, and friendly, playful. And so dogs or behaviors that were considered aggressive were growling, having an inhibited bite, showing teeth, snapping, stiffening, and having an uninhibited bite. Fearful behaviors around this is with either of the dogs, backing away from the dog, crouching, lip licking, running away, tail tucking. And then we have friendly or playful behaviors that were jumping on the dog, licking the dog, pawing, play bowing, play growling, or wagging their tail. So in an attempt to really try to understand what the heck the dogs are doing, we collapse them down into these 3 behavioral traits: aggressive, fearful, friendly, playful. And what we see is that the highest degree, take a look now at table 3, we can start off, this table is not as scary as you think it is, that we can take a look at fearful, that friendly, playful behavior. And we can see that positive agreement means it's there between both the live dog and the fake dog. Negative agreement, it's not there in either case. And then we have some other measures of agreement. But what we can see is that the highest degree of agreement here is actually with the friendly behaviors. What are we all using stuffed dogs for? If we're using them. Are we using them to figure out if the dogs are friendly with each other?
Reactivity.
Right. We're using plushy dogs for reactivity, to try to keep our own dogs safe, other dogs in our care safe. Adequate agreement was not seen with the aggressive behavior. It was actually had the least agreement among the 3 behavior traits, and there was only moderate agreement for fearful behavior. And so the takeaway here is that it is possible to use a fake dog, but not in the way we think. That it's probably for fearful behavior, for friendly behaviors, but those fearful and aggressive behaviors, which we really need help with to keep our other dogs safe, it's likely not as consistent. So that sort of stings. Okay. So here's a paper that was published more recently by Liam Clay. He's done a lot of work. I really encourage you all to take a look at Liam's work as well as Connor Gould. He worked with Newberry, and both of them have been doing really cool work to try to understand how behavior assessments work. And so he came up with a really clever study here. I think it has some limitations, but I think that, one of the questions that we're often left with in sheltering is that, we don't know the dogs before they come into the facility. We just don't. We have owner surrenders, that's great, but if they were transferred, if they arrived as a stray, we may not know a lot about them. So to address that issue, they worked with 107 dogs, and their owners completed a CBARC about their dogs, and then they came into the shelter 1 or 2 weeks later and had their dogs assessed assessed in the shelter for a behavior assessment. So they were using the ASPCA's behavior assessment. And so the assessment is pretty standard. They have things about handling, play, they do a run and freeze test, there's food guarding, stranger interaction, left alone behavior. So again, kind of doing the typical things, and this is all outlined in the paper. This paper in animals actually is open access, and much of Liam's work is open access, so you can check it out. But what they found was that they found positive correlations between the shelter assessment and the home behavior around fear, arousal, friendliness, and anxiousness. What are we not seeing there? Aggression. And they reported that when they took a look at the CBARC questionnaires of the dogs, they didn't have a lot of reported aggression in the home. And so I think that is one challenge that we have here, is that it is not necessarily a behavior that is occurring very often. And so because of that, it may be hard to detect. Some, though, may not happen very often, but are incredibly predictable. They always happen in a certain situation. But I think other times we have aggression, and it may not. It may display not very often and in different situations. And so here are some highlights from the paper that I thought were sort of interesting. They found that room exploration, touch sensitivity, and responding to an unusual stimulus were related to what they called non-social fear. And that was in the CBARC. Touch sensitivity on CBARC actually was related to how they performed in the shelter behavior assessment. And then things like excitability and energy that were described on the CBARC, that was predicted by room exploration, touch sensitivity, and the time alone test. So again, I think that these are sort of some interesting tidbits. I think it's a bit frustrating. We don't have a sort of, that's cool, don't worry about it. It was totally cool. That would be our unusual stimulus. We don't, I think what's challenging here is that we don't have this one assessment that we can just pull off the shelf and use. And I think that can be a bit frustrating. But I think that we can take a look at some of these relationships between how the dogs behave in the home and how they behave in the shelter to try to kind of give us some information about what behaviors maybe we should be paying attention to or what have some predictive validity. All right. Yay. I've lulled you into a false sense of security. And now we're going to talk about food guarding. All right. So I'm going to talk about a couple different papers on food guarding. The first paper, Heather Mohan-Gibbons and colleagues conducted back in 2012. And this was essentially looking at dogs that had guarded their food and looking at how owners described them post-adoption. And what they found actually was that only 13% of the dogs, as reported by their owners, displayed aggression or concerning behavior around food or toys at least once during their 3-month follow-up period. And I think if you look at that percentage is pretty low. And I think that, again, this work struggles with the fact that, we're not assessing the dogs, or even the owners aren't doing the same type of assessments we were doing in the shelter. And so we are sort of correlating these different situations. Whoops. Hello, friend. Do you want to work? Okay. So the next paper I want to chat about, because this one I find very interesting, is this is some really great work that Amy Marder and Sheila Segerson did at their time at the Center for Shelter Dogs. And so they were taking a look at food aggression in the shelter and comparing how the dogs behaved in the shelter to how they behaved in the home through owner report. And what they found was that 55% of the dogs that displayed food aggression in the shelter actually continued to do so after adoption. So positive there. And 22% of dogs that were not food aggressive went on to actually aggress over food. So they were sort of missed, right? We asked them the question, they said, no, of course not. And then they went into the home and did. The thing I want to bring up is that for those doggos, that 55%, we have about then a 4 times likelihood that if you guard in the shelter, you're going to do it in the home. So compared to dogs that don't demonstrate that behavior. I want to kind of sit with that for a second, because I think that in my experience, that lines up with my experience, right? I did many assessments. I worked at an animal shelter in San Francisco where I was responsible for every single dog that came into care. And we were a transfer-in facility, and I evaluated every single dog that came into care. We were also a no-kill shelter, and by no-kill, I mean that in the very strictest sense. And euthanasia was an incredibly rare occurrence. And so it was a difficult situation for me because it's a lot of responsibility because you want to make good choices. And so I think that this idea then about this likelihood of dogs guarding in the home, that doesn't mean that we don't place these dogs. And I think in some ways we've confounded these two. That no, the owners don't care. That's a different question and a different conversation than whether or not they might do it. And I think that we are at a point that we can provide support to our owners or let them know, hey, it's possible that this is going to happen. And in my experience in sheltering, most folks like to be told that something may happen versus being surprised when it happens and they weren't told about it. So I think that that's something that with this work on food guarding, it is likely that they're going to do it if they do it in the shelter, more likely than not. And the other thing to think about here, which is a thing that I have lots of questions around, is that we still don't know the relationship between severity of the behavior and likelihood of aggression. And I think that this is an important part of this discussion because my guess is that because dogs in this study, I think ones that were had severe food guarding were actually not placed. And then we have an issue that dogs that were mild to moderate are in the group with dogs that are more moderate and we have dogs that are in this positive food guarding group that are everything from mild stiffening to ones that are growling and snapping. And my guess is, I have not conducted the study, so these are just my awful research assumptions. But my guess is that dogs that have greater severity in the behavior, they might be more predictive of doing it in the home than those that maybe are a bit more subtle about their behavior. Maybe not, but I think that we don't know the answer to this question. And I think all of us when we think about placing dogs and we see the food guarding, when they run their teeth up, our arm or a fake arm, we're going to pay much more attention to that than the dog that's eating and maybe just looks at you sideways. But we actually don't know if there's a relationship there because it hasn't been studied. So the last bit of research I want to chat about is what's been done to look at removing the food guarding test. And so this is, again, work that was done by Heather Mohan-Gibbons and colleagues back in 2018. And the diagram here, you don't have, I leave it for you because there's so much to dig in on this. But essentially the setup to this study was that there were two different phases. There was a baseline phase where they were able to actually not assess many dogs, but assess a big group of dogs and identify what percentage of those had food guarding and those that didn't. And then based on that, they looked at the two groups. So this is on the left-hand side, this side. We're looking at, hey, you had food guarding, you didn't have food guarding, and then their likelihood of injuring somebody in the shelter, injuring somebody in the home. And then they removed the food guarding test, and then looked at looked at dogs. They had 3% that were identified in the shelter with food guarding. We have a lower identification of food guarding because we don't have the food guarding test now, but we're somehow getting it much more in the history. I can't quite explain that. And we're seeing, of course, many more in shelter observations, right? Because now we're relying on feeding them or being in the kennel and using those observations. And then again, we're taking a look at the bites and injuries in the shelter and in the home. And the takeaway from this study is that based on this research and the study's findings, the authors recommended discontinuing the food guarding. And I think that if you look at their findings, looking across the two different phases, this is going across reading horizontally, you will see that there are not statistically significant findings between changes in shelter bites and injuries, in shelter, and bites and injuries in the home. We can all agree on that, right? We're all kind of reading the same thing. Okay, cool. But here's the thing I want to focus in on this, and this is, again, based on, think about the conversation we just had about Amy Marder's work, is that in both phases, food guarders in the shelter are more likely to cause bites and injuries in the home compared to dogs that weren't identified as food guarders. So take a look, then, at, on the left-hand side, we have bites and injuries in the home, and bites and injuries in the home when you have food guarding, when you don't have food guarding. That is statistically significant. Same thing applies when we remove the food guarding assessment. Bites and injuries in the home by dogs that were identified as food guarders is higher, statistically significantly, compared to dogs that don't have it. Again, this does not mean that we don't place these dogs, but it does mean we need to know a little bit about what we're getting into. That if we see that behavior, it is likely that they may display it in the home, and we need to provide supportive care to the dogs so that they can be successful in their homes and their owners know what's going on. So I think one of the reasons why we struggle with assessing behavior in the shelter is that we're looking for this single, efficient, structured assessment that is going to tell us about that true dog. That if I just ask the right questions to this dog, they're going to tell me who they are, and then I can decide what we can do with them. And the reality is, it's not been completely possible in this situation. We have nuggets, bits and pieces, but it just isn't there yet. And why? Why are we all struggling with this? Do we not care about what we're doing? Are we not smart people? Why? And I think it's none of that. I think that the shelter is this really stressful place. And behavior is influenced by any number of factors, right, that make this task very hard. Genetics, life experience, current environmental conditions, the emotional state of the animal. We can name so many things that make it really hard to understand the dogs. And I think separating out those behaviors so if we want to separate out behaviors that are reliably seen across multiple contexts from those that are just situational, and that doesn't mean that the situational stuff doesn't matter. When we're caring for the dog in the shelter, if they're having a particular challenge around being in a certain situation or interactions, we need to pay very close attention to that. But we need many observations of the dogs by many people in many different contexts to be able to have an idea of how they might behave. And so I think we want any degree of confidence in our decisions. We've got to collect the many puzzle pieces about these dogs. We've got to be doing that. So I want to close with how do we move forward? Is hopefully I haven't completely, like you're not completely dispirited now and you're like, what the heck do? I don't even know what to do walking out of here. Which is fine. I mean, you should kind of sort of feel like that, but I want you to be like optimistic. I think we have to accept behavior assessments for what they are. They are a snapshot in time at that moment of the dog's behavior in that particular situation, but it is part of a bigger picture about that dog. And that unless the dog's behavior is incredibly egregious and dangerous, this is not a pass-fail situation, and it should not be. And that's why it's bolded, because yes. And, you know, you may be in a situation at your shelter that you need to use some sort of published assessment. I recognize that could be a situation that you're in. And I think a big thing is that then you've got to be willing to train your staff on how to do it, continually maintain that training, and record everything. Be recording every single assessment. And then utilize that information to inform the dog's care. But it's part of a bigger picture. That's why I keep on saying this. This is not a one and done thing. And we've got to then also observe, use those video recordings not only to look at them as a group and be able to like expand our expertise and knowledge and skills, but then also see how the staff is carrying them out, and are we okay with it? You know, are we remaining consistent, or are we seeing drift? Are things too provocative? Are they not even being carried out in the way that we think they are? And I think if this can't be done, if we can't be training our staff, if we can't be recording everything, if we can't be talking about it, don't use an assessment. You've got to be willing. This takes time and work as well. So we can't just say, oh, I'm going to use this package off the shelf. Who cares if everybody's doing it the same? We're not recording it. Maybe this person's really provocative. This person's not. We're not even necessarily following it. Instead, I want you to really use lots of real life observations. And that's what, in our consultation service, that's a lot of what we recommend, is that you've got to put your behavior collection everywhere. So I want you all to walk out of here wanting to be being behaviorists. Collect as much information as possible while the dogs are in your care, using what we would call a mixed assessment model. We've got to, I bring this up multiple times, we've got to give our staff the skills and the training to be able to observe behavior and, when appropriate, interpret it in a variety of different situations. It doesn't mean that everyone's going to be an interpreter. It's okay. There can be, you know, folks that are specially trained for that, but we've got to make sure that we can at least talk in the same language about what we're seeing. And then incorporate behavioral observation into everything, because we're already seeing everything. We see it at intake, we see it during exams, we see it on walks, interactions. And if we're going to collect and record information in dog-to-dog activities, we've got to be mindful about what techniques we're using in these interactions. If we're using punishment-based techniques that are suppressing behavior, you know, we can't say that that's okay and like behavior assessments are like awful, right? We have to acknowledge the limitations of both. And I think, again, that in my mind is a reason why we want to use positive reinforcement techniques in our dog-to-dog activities, so that we can see how the dog's behavior, the behavior of the dogs are around people, around dogs. And then, of course, please not be surprised. Of course, we're saying implement field trips, sleepovers, and fostering programs, because we want to get that real life information. And essentially, as we move away from the shelter in foster care, a couple days in the home, 6 months, and for predicting to 6 months out in the home, we can see that as we get out of the shelter, and then once we get in the home that they're actually going to live in, those first couple days, our group has found, Rachel Gilchrist, a graduate student in the collaboratory, is finding that, in fact, that first couple days in the home are most predictive of how they're going to behave at 6 months. And I think that you know, behavior is all about the environment, so no big surprise but think about what that means, though, for your adopters and what type of support we give them. We often hear it all the time, we don't know anything about the dogs. I disagree. We know a lot, we're just not recording it. And I think this is where technology comes in. We've got to make it really easy for folks to record the information. Believe that the owners are actually telling the truth. because they probably are, especially if we're not asking really tough questions face to face. But if we're giving them questionnaires that they fill out ahead of time, and that's some work that was done by Duffy, Kruger, and Serpel, found that there was no consistent effect of telling the owners that the information they were going to use and that the information they were providing was going to be used in shelter decision making. Whether they said it was non-confidential or confidential, it didn't make a difference. I'm going to skip this because I think we're running out of time. I think, like I mentioned before, really have a feedback system for volunteers, staff, and foster caregivers. Make it really easy to provide useful information. And I want to plug the chapter that Pam Reed wrote on assessing the behavior of shelter dogs in the new edition of Animal Behavior. There's some really great surveys and word banks that you can use. I think we can't expect folks to just come up with what they observe out of the blue. Make it easy for them. Have phrases that they can circle. This is not an opportunity for fill in the blank. You know what I mean? And as we brought up in our research on emergency fostering during the pandemic, we found that foster dogs with known behavioral issues were 3 times more likely to be returned by their foster caregiver for behavior-related issues. I think that that's important to know. So with that in mind, talk to your adopters post-placement. We've got to get better at this. We need to learn your shelter, each one of you that are, each of your shelters that are placing dogs in the community. We need to know if our behavioral criteria is working. What are our placement guidelines? And what is it like for these folks to live with these dogs? I think data is the way we move forward with this in our individual shelters to make sure that our criteria is fitting our community's needs. And based on our findings on emergency fostering, it's likely that both foster caregivers and adopters of dogs that are being placed that have known behavioral issues, they need much more support in order to be successful. So if we're going to place dogs that are a little bit more challenging, we've got to help folks do it. So with that, I want to close with a summary that Pam provides in her chapter and just leave it up here, that every shelter should have a structured system for continually assessing the behavior of the dog throughout their stay. The information gathered may determine if the dog is appropriate for placement, guide matching with adopters, identify dogs who need behavior modification or help coping with the stressors of the shelter, or determine if the dog should be humanely euthanized for safety or quality of life. Continually behavioral monitoring can help identify a shift in the quality of life, the emergence of an underlying medical condition, or the impact of behavior modification. By striking the right balance of amount and type of information, shelters can make the best and most expedient outcome decision for each dog in the shelter. And with that, I'll close. Thank you.